Hi, I'm Dr. Stan Steindl. Welcome to Compassion in a T-shirt. Today I'm speaking with Dr. Audra Horney, who's a licensed psychologist and therapist for men based in Arizona in the USA. I came across Audra on Instagram, where she's a staunch advocate for men and men seeking therapy. How can we make therapy feel relevant for men? How can we make therapy feel comfortable for men? And how can we make therapy feel safe for men? We do a deep dive into her perspective on all of that, but also how might compassion fit in? Different people can have different thoughts about compassion and self compassion or receiving compassion for others, and men, of course, are no different. She offers us some real pearls of wisdom, and so I bring you Dr. Audra Horney. Okay, well, Dr. Audra Horney, thank you very much, and well, welcome to Compassion in a T-shirt.
Thank you for having me. I'm excited to chat.
You've dedicated much of your work to helping men, I guess, engage with therapy and often
hmm
for the first time. I mean, first of all, I suppose, yeah, what drew you to focus on men's mental health specifically, and what makes that feel important?
Sure. Yeah, it's a question I get often
Mm,
because when I tell people that I'm a therapist and then follow that up quickly and letting them know my specialization is men's mental health, I'm a therapist for men. I get a lot of honestly shocked, surprised, grateful, confused reactions. It really runs the gamut. And unfortunately, I think it's because it is not very common for women in particular to focus on this area. And it's genuinely the work that found me. I didn't pursue this in graduate school. My focus was on more, generalist therapy. But I did attend programs that had strong multicultural or social justice focuses. And so honestly, that has informed a lot of my work and advocacy in this space because I believe that we all deserve inclusive, culturally informed spaces for therapy. And unfortunately, I believe that's significantly lacking for men. And so this is the work clinically that I've done for about 10 years in different agency settings and private practices. And then it was just a few years ago when I left a group practice to start my own practice that I started speaking more publicly about my specialization, started creating content on social media, and now have had the opportunities to speak to people like you and spread this message further and really lean into the advocacy component of this in, I think a way that has significant reach in a way that is significant beyond what can happen one-on-one in our offices.
mm. And where are men at the moment, do you think, in terms of like what makes or what can a therapy space offer, do you think, for men? I mean, there's a reluctance there sometimes and so on, and yet it seems important. What might they get there that really they're not getting elsewhere?
Yeah, I mean, I would argue, and I think I could back this up, that the men are not all right. And they, I believe, are really desperately craving connection and support and to be known and to be seen, and not always knowing where to find that, or not always knowing that each other wants that as much as they do. And I believe that, therapy can offer this like really safe container for men to exist, to be messy, to be inarticulate, to be confused, to be angry, to be frustrated, to say that they're struggling. Sometimes I'm very much myself in the therapy room. I try to incorporate humor and sarcasm and I'll say things to my clients, especially early in our work together when I can tell they may be hesitating to like really share what they're struggling with and to speak to a woman about, being a man and having a hard time. And I'll joke and I'll say, I get it. Like, I'm not going to tell you to go post like whatever you say here on the internet. Like that will not go over well, but I promise you, like I'm not going to cancel you in here. Like I'm not trying to trap you. I'm not trying to back you into a corner. I truly believe that you're struggling and I just want to understand your story. And I think therapy should be a space where men can assume that they receive that. Unfortunately, I don't think it is always a space where men feel that sort of safety. And so that's informed a lot of my work in advocacy online is not just letting men know that those spaces exist for them, but really calling therapists to the table to say, we can't, I don't believe we can responsibly shame men for not going to therapy if therapists aren't doing our part to make sure that therapy is marketed as a space inclusive of men.
Mm. I really sort of in my own way feel that too. In terms of the first bit that you said that it can feel threatening to actually say what you think in the modern
Yeah,
world, and yet we need to be able to say what we think so that we can kind of work out what we think and we can sort of navigate our way through the
right.
different bits to that. And yet if we blurt something out, it can feel risky and that will kind of
Yeah,
have some sort of negative consequences. And so well, I guess a lot of people just therefore don't speak, or
right.
they go online kind of with a pseudonym or something, and then they say all
Uh-huh.
sorts of crazy stuff too. But to have a
Yeah.
space where it feels reliably safe to actually have that conversation. You've talked before in podcasts about how often therapists present themselves with the websites with soft colors or with the little
Hmm.
gentle quotes and that
Right.
sort of thing. Whereas you said somewhere that you have the man in the arena quote, I think, from Theodore
I do.
Roosevelt in your
Yeah, it's in
room.
my lobby, in my
In
waiting
your
room.
in the waiting room.
Yeah.
So,
Hmm.
well, what is that quote actually? And but also, yeah, what do you do to make that therapy space feel kind of safe and or even relevant, I guess, for men?
Yeah, I mean it's across all of my marketing and my branding. Like I really want what I'm putting out there, my, even myself to be very clear and consistent. So I think that is huge when we're trying to build trust that, this is a space for men. And so whether it be on my website and the language that I'm using, or, the design and fonts and colors or pictures, I'm in my office right now, and I have a lot of like leather and earth tones, and my waiting room, as you mentioned, has a like, wooden engraved man in the arena quote, which is by Teddy Roosevelt. And it's essentially, if you've read Brené Brown's Staring Greatly, she pulls from this quote in that book. And it's ultimately saying, I don't know if you want to read it, but it's saying, let's not fault the man in the arena with the dirt on his face and the blood on his hands. Like he's the one working so hard, and you're going to be in the stands and you're going to laugh at him. Like, what have you done? Like, let's get in the arena. That's where the growth happens. It's hard, but it's worth it. And so it's the first thing men see when they walk into my office is this quote. And I love the quote personally. The work that I do and the reason I love this work so much is just what feels most true to me. Like I resonate. I mean, I didn't just create a man cave out of an office. I created a space I want to be in. Like I feel comfortable here. And I also want to make sure that that space feels welcoming of men. But it's true to me too. Like it's not an act. It's not performative. These are things I stand by and believe in. But I do want to make sure that when men interact with my content or they're in my office, or they are on my website, that they feel seen.
Yeah. Yes, there's an authenticity that really matters there, isn't there? For the therapist,
Oh,
really,
yeah.
that you
I think that's I think that's everything. And I think I'm going to stop. I'm going to speak in, general terms today, of course. Like I can't speak about all men and all therapists or all like, so I'll speak generally, just as like a caveat, I think, to cover
Mm.
me for making some broad statements. But I believe that like men, especially coming into therapy, are like demanding authenticity. They might not say it that way, but they're going to smell bullshit from a mile away. And so if I'm showing up performing or putting on a therapist voice or not leaning in to even like a joke that I might find funny that maybe it's a little bit inappropriate. Like if I'm not showing up honestly, but I'm asking him to, if I'm not showing up authentically and professionally and ethically, of course, but authentically, and I'm asking him to, like, what a fucking fraud. Like that seems so unfair and it seems so unproductive in my opinion. And
Mm.
so it's one of the reasons why I really love social media as a therapist myself, because I show up very honestly there. And again, professionally and ethically and boundaried, but I say what I mean and I feel confident standing up for the things that will stand behind. And I think that resonates for people. Like especially right now, I feel like in a world where like AI and these sorts of things are taking over, like I think are just going to become like more and more depleted of authenticity and just real human interaction or content. And so like we gotta, I think as therapists, I believe it is like I'm not a blank slate therapist and I I don't shame anyone who is or he keeps himself more out of the room. But for me, utilizing an appropriate degree of self-disclosure with my male clients is crucial. Like I feel like I build rapport and buy-in by sharing things in the room so that I'm human too. I'm not coming at them from this better than you expert pedestal. And that degree of authenticity may not be even how I was trained as a therapist, but I've learned a lot through this work that I've done. And it's like I said, it's still boundaried, it's still ethical, it's for the client. But I just think if we're going to show up for our clients and this conversation specifically with men in a way that they're going to want to come back, then it
Mm.
sure as hell better be honest.
They're kind of looking for, or they or we are sort of looking for any
Hmm.
excuse to flee, really, aren't we? And
Exactly.
inauthenticity would be a good reason not to come back. And
Yep.
so yeah, trying to find someone who can be sort of real and kind of authentic and genuine and laugh along with our sort of crazy jokes or whatever,
Hmm.
but authentically and that relationship piece seems to be the key.
Yeah, it starts before I have met them. It's another reason why I,
Mm.
think being on social media can be so powerful as a therapist. My clients who find me through social media are able to vet me pretty thoroughly before they try to get on my calendar, and many do for months and months and months before they reach out. And yeah, of course you should. Like, see if I'm just performative in the ways that I'm speaking and showing up and what I stand for. See if can sniff out any bullshit. Like, you should demand that I be someone you trust and see that what I say, that there's consistency in what I say. There's consistency across like wherever you might see me, whether it be on a podcast or on a website, and then sitting in my office, like it should feel consistent. And that's relationship building, right? Before I even realize that I'm doing it, like or I'm passively building a relationship. You said before, I think before we started recording, that you feel like you
Yeah.
kind of know me already because of my content or listening to podcasts and what an awful experience it would be if then you're sitting in my office and I'm this completely different person and you feel like there was this bait and switch that happened. Like this this is so pivotal. Like this is so crucial to the work we do. The work we do is relational. And in this modern era where we can show up in all these different mediums where a client can hear me on a podcast or see me on TikTok before they enter into my space, like it is my obligation to make sure that I am consistently showing up in a way that they can build trust before and maintain trust after they meet me.
It's so funny because just before you mentioned it there, I did suddenly reflect on the fact that I had said that before we got on to the actually recording that, and so I suddenly realized that I had the very experience that you're describing in a funny sort of
Yeah.
way, because it does come across online in all of those forums in a very kind of real sort of way. And there's a few I don't know if they're myths or something, but one of your posts, one of your pinned posts sort of says, you know, things I didn't learn in grad school re therapy
Mm.
for men. And the first one is, you know, humor in session isn't deflective.
Yeah.
And be ready for it to be dark is what you've said there. And I think
Yeah.
there are little things like that where, and you hear it actually, you hear it amongst therapists that humor gets kind of pinned as being like a defense mechanism or something like that.
Yeah.
And you've really kind of, I guess, discovered that actually it's not necessarily so. You know, it has other lots of functions really, humor and other
So
things.
many, so many functions. Yeah, I think humor is a big one. Humor to me, like that's part of the rapport building process with my clients. It's part of the vetting process. Like if your sense of humor doesn't jive with my sense of humor, like our therapy's probably not going to go very well. If my jokes don't land, you're going to find me very annoying and not want to come back every week. And
Yeah.
so I think that in terms of, finding that fit and connection, it's huge. And in relation to it being a defense mechanism, like, I incorporate a lot of IFS or parts work into the work that I do. And I think if we, walk away from this idea of a defense mechanism or something being deflective, and we think about it as being adaptive and protective, that takes on such a different shape and feel. Not to mention humor as like a moment to breathe. Like I feel like sometimes some of the funniest moments where my clients and I are maybe like in tears almost in laughter are in the midst of sometimes the darkest, hardest moments. Like I think that in the work that I do with men, so often that humor is an opportunity to like get your head up above water and take a deep breath before we submerge again, and to, call that out or dismiss that as defensive or avoidant without understanding the function of it is, I think, just uh, a
It's missing an
it's a
opportunity in a way.
it's you're right. It's such a
Mm,
missed opportunity.
mm. Yeah, no, I remember learning that lesson very much with the veterans. That was sort of
Yes.
Vietnam veterans from some years ago now. But yeah, and people around me feeling like it was just a deflection, but it's not. It's part of the dance, and it's important, you know,
Yes.
functionally to actually then also, you know, kind of get to the hard stuff. My approach that I often take, compassion focused therapy is sort of an
Hmm.
approach I use. Although, funnily enough, I'm interviewing someone this afternoon about IFS, so I'm
Mm.
excited to learn more about that. But I think there is quite a lot of crossover there, because in CFT
Hmm.
we might also work with parts as well, you know, multiple selves
Yes.
and the multiplicity and trying to understand the motivations and that sort of thing. And but we work towards, I guess, cultivating the compassionate mind or the compassionate
Hmm.
self. And you know, so compassion being this sort of motivation to be sensitive to suffering in ourselves or in others, and then a commitment to try to alleviate or prevent that suffering.
Hmm.
And so it's interesting that you've mentioned IFS, because I know the self
Hmm.
comes along, I think, with a kind of
Definitely.
a compassionate motivation as well. But I wanted to sort of see what you thought here about men and compassion. Like, how does this idea of
Yeah.
compassion, or self-compassion for that matter, how does that resonate with your work with men? Or do you use that language, or do you use other words or framing to help them connect with some of that?
Yeah, I'm so glad that we get to have this conversation because it's I've learned along the way that there are just words that if I have to be prepared if I use them, they're going to get a reaction that I may not be intending with a client. Like there are a handful of words now that I've learned through the years where like, oh, I'm gonna have to defend myself in using this word. And compassion is one of them,
Mm.
self-compassion in particular. And I find that a lot of men I work with immediately take that as like pity
Yeah.
or like weakness. Like I don't want your pity. I don't want to pity myself. Like this idea of like, oh, that's just me like settling. That's me accepting that I've failed and I'm just gonna be okay with that and not push myself harder. Like I've experienced this really adverse reaction to the concept of self-compassion. And so it's actually caused me to like use the term less in my work with men. And but it's interesting because in incorporating IFS, for example, like it's very much about being able to understand and recognize and like integrate these parts, but also be able to clarify your self energy. And with that is like compassion, like that's where that's housed.
Mm.
And I think that the approach that I generally take though with men is more about giving permission to like respect or understand the suffering parts and like through that to gain that access to like love for themselves and compassion for what they went through. So I feel like I go through maybe like a back entrance to say like this part that you hate so much, like can we understand that? Like what where's that rooted? How long has that part been there? Can we understand where its pain is coming from? And I think oftentimes there is such a childhood component there that I have a lot of men who can connect with the love and like compassion they might have for a kid, for even their younger self or their own children. And it's like through that, it's often I feel through that like shift in perspective taking that I can bring a client to a place of like, I guess I deserve that too. I probably shouldn't be, eliminated from the list of people who deserve compassion, but I found that if I if I go sort of like heavy-handed directly into self-compassion without kind of setting the stage, I've found that men will often try to like almost push that away. Like that's not
Mm.
for me. Like I may offer that to other people, but I don't want that pity from others. Like may misinterpret
Mm.
it as something different. And I don't want to like lower the standards for myself.
Mm. Yeah, that's clever. I mean, we think in CFT about those fears, blocks, and resistances to compassion or self-compassion, and you described a number of the things that can come up. The sort of it
Mhm.
feels too much like self-pity, or it feels too self-indulgent, or I'll get lax
Yeah.
and lazy, or I won't be
Yes.
as motivated, or those are the sorts of kind of reactive bits that come
Hmm.
straight, sort of react directly to even just the word sort of thing. But if you come at it a bit more from that notion that there are parts of ourselves that are really suffering, and
Yeah.
and to not only that, but to be able to see that suffering as also not really my fault. Actually,
Right.
it's often arising out of early life experiences or things that have shaped us over time, and
Hmm.
sometimes direct sources of suffering like trauma and so on, but sometimes also indirect ones like just the social messages that men receive about how they
Hmm.
should be strong and stoic and
Right.
self-reliant and all that sort of stuff. But if you can firstly help people to think about and connect and to sort of de-shame the suffering, then
Hmm.
the kind of helpfulness and the alleviating the suffering or the care or the compassion makes a lot more sense, I guess, or something like that.
I've found that that's an entry point. Like there's more access there. But as you bring up, how men are socialized, I think that's a piece of it too. I, I mean, I only have the experiences as a female clinician offering therapy for my male clients, but I often have clients get really uncomfortable when I'm offering empathy or validation, and they have a really hard time owning their own accomplishments and giving themselves credit and self-love. And so I think there's also a socialized component of this where self-compassion or empathy is not something that as many men as I wish like had experience receiving, even as kids feeling like they were neglected of that sort of emotional support or encouragement to love themselves the way we
Mm.
might encourage or offer love to younger little girls. And so I think that might be a piece of it too, is that, I watch my clients get like squirmy when I'm offering them feedback and validation or highlighting their progress or highlighting their strength or resiliency. And so if it is difficult to receive even from an outsider, then it would make sense to me that it would feel uncomfortable to offer it to themselves.
Yeah, I've just had John Mayer's daughter's song pop to mind for some reason,
Oh
and so
yeah.
I've just looked it up here. Um, yeah, boys you can break. You'll find out how much they can take. Boys will be strong, and boys soldier on. But boys would be gone without warmth from a woman's good heart. Oh, that's a nice ending to the. But I was remembering those first couple of lines.
Yeah.
It is interesting. It's built into kind of our social worlds and our sort of expectations of boys growing up, and often they are more kind of encouraged to soldier on rather than to know really what it's like to experience empathy or soothing or some of those
Mm-hmm.
aspects that might, come in with self-compassion.
Mm-hmm. I agree. Yeah.
Mm. So, um, so how do you actually move into working with feelings, I guess? Like what do you do there in terms of kind of naming feelings, expressing needs, developing,
Mm-hmm.
I guess, a kind of wisdom with men? Actually, to be honest, in CFT, we think of compassion as being made up of wisdom and strength and
Mm-hmm.
courage and caring and so on. But yeah, how do you help men build a kind of emotional vocabulary there?
Yeah, it's a big part of the work I do, especially early on with men who maybe have never been to therapy or haven't engaged in that sort of like personal growth work, or coming in, fairly like emotionally suppressed and struggling because those emotions have manifested themselves maybe in other ways and addiction, anger, other symptoms. And I really love using Mark Brackett's emotion grid. He wrote Permission to Feel, and it's a wonderful grid. I like it in contrast to an emotion wheel because it offers emotions with two different axes of I think it's low to high energy or low to high pleasantness. And so it gives a little bit more direction. I feel like the emotion wheel, anytime I hand that to a male client, I always preface it with like, this is going to be way more emotion words than you are ever going to want or need in your entire life. And I feel like with the emotion grid, though, it's like, okay, ground yourself on the axes. Like, how's your energy? And does it feel good or bad to be where you're at? And then you get to kind of focus in on these cluster of emotions that might land there. I also think it's nice because it can bring in more of that like psychosomatic or physical experience of emotion that a lot of men might notice before they notice or even know how to name an emotion. Um, so yeah, that's something I share with clients and we use this in session. I always tell them save it on your phone and use it every day. Um, and I offer education too in normalizing the fact that maybe they've only really been encouraged to be fine, numb, or angry. And, maybe they
Mm.
only had permission to feel other emotions during intimate moments with a partner or when the football team won the state championship, right? Like you have these specific little moments in life when men have that permission for a broader span of emotions. And so I normalize that a lot and normalize the fact that if you're not feeling much, like I bet when you are feeling it, it's really overwhelming. I talk about the window of tolerance and dysregulation and what that might feel like for them in their bodies. and normalizing how a lot of these emotions may come through the channel of anger because maybe that's the only emotion they saw modeled by other men or the only one that was allowed. And so I think that sort of education goes a long way. And
Mm.
I don't make any assumptions about what my clients might know or not know. Many of my clients though will tell me, I'd just rather not feel my emotions. I wish I didn't have them. I don't want emotions. I don't have emotions, right? Like I'm just logical. And just even then providing the education around that, like, well, you may do a really, really great job of bottling up those emotions, but I promise you've got some. And whether or not you're able to articulate it or you feel like you're, expressing them in a way that is productive is another thing. But not shaming that, like really, again, like normalizing and educating around the ways we even like socialize little boys and little girls, and telling my clients that, studies have shown that baby boys are more emotionally expressive than baby girls, but we socialize that out of them after a few years. And so being able to just bring in the science, I find is really helpful because it's not just me speaking out of thin air about emotions and why I think they should feel them. I'm like, here's what the research says. Here's why it's productive. Here's what emotions do for us. It's not just emotions for the sake of emotions. You're stuck, you're numb, you're unfulfilled, you can't make decisions. It's because you don't have your emotions in order and you're not using them to their advantage.
Mm. Yes, anger's sort of one thing, isn't it? It's more commonly felt and experienced and understood and expressed and so on.
Yeah.
Anxiety too. What are your thoughts about sadness? How do you go
For
with
men,
for men? Yeah, with going there because that's sort of such a vulnerable feeling, that emotion, to feel sad, and sort of even evolutionarily, sadness is very vulnerable, because we cry and we can't see and we can't breathe very well and we feel weak at the knees and
yeah.
we can't run. But for men too, I'm often curious about sadness and how to start to access some of that, work through it.
I mean, I find uh, the the channel through shame is a pretty effective
Mm,
one. Shame is an emotion that almost all of my clients have intimate experiences with, but hardly any of them are naming it as shame when they're coming into my office. That's something that I might be reflecting to them as they're describing something to me. And I say, like, that sounds like shame, or it sounds like you're really ashamed of yourself. And like almost overwhelmingly, the reaction is like, yes, exactly, shame, but not often the emotion they're naming themselves. And I think through that, like that's where you access pain. That's where struggling or suffering is often rooted, like in those dark
mm,
corners. And for many clients, sadness might be there, but I think often, there's numbness or that like even apathy. There's so many protectors, I think, that come in. There's so many layers often between men and their sadness.
mm,
And I, I see it every day in my office, the different ways that men stop themselves from crying and I see them swallowing their emotion. I see them aggressively drinking their water bottle. Like I see them doing lots of things before allowing themselves to get there. So, my job is not to force any sort of emotion. My job is not to get men to cry in my office. It's about helping them tap into their honest, true, authentic selves.
mm,
And I think, with patience and curiosity and compassion, like if sadness that is there and men can feel like trust with you and like trust in their own bodies. I think a lot of men fear like if I let that dam break, like it's never going to be stopped. I think there's a
that's a
fear
big
of
fear.
like if I
Mm,
tap into that, I'm never coming back from it. So I think there's
mm,
a lot of like trust and like I said, as a therapist, being able to build a container and reassuring my clients, like you're not leaving my office today. Like I'm not just gonna poke around and make things a mess and then send you on your way. Like if things get hard in here, we're gonna be sure that we pull out of that and I help you regulate and get to a steady place before you go. And being able to even like reassure men, like, I got you. Like, there's a box of Kleenex on either end of my couch for a reason. And there's going to be moments in here that feel uncomfortable, and that's okay. And again, like I'm not trying to get you to cry, but I'm also completely cool with it if you do.
It speaks again to the importance of context, that the therapy space and the room itself and the experience of that, and maybe the preamble of seeing the therapist, or getting to know the therapist before you even meet them. But then once you're there,
Hmm.
having that relational safeness, because it just takes so much courage really to get there, to go there, to actually explore some of those bits that are below the layers, the much,
Absolutely.
especially shame and that feeling of, just I'm inadequacy and inferiority, and I'm just no good and I'm unlovable.
Right.
Those are very
Right.
deep and dark feelings that are very painful, and it takes a lot of courage to go there. It can be useful gently to go there and to kind of work
Yeah.
through it. But you mentioned, I guess, shame and maybe self-criticism. Tell me more
Hmm.
about self-criticism with men. How do you see that in presenting there, or, and how do you maybe help people work with that tricky inner voice?
Yeah, I mean it's ever present.
Mm,
I see a lot of men using that, I would argue unsuccessfully, but using that as their like self-motivation. Like this is how I get up and keep going. This is how I don't give up. Like I'm hard on myself. I kick myself, like that tough love sort of approach with themselves. Um, and I'll joke with clients when they're adamant that like, no, this is like I can't let this go. I would, I'd get lax. I'd settle. I wouldn't push myself harder.
mm,
I'll reflect to them like, well, it seems like you're really good at the self-criticism. It doesn't seem like you've been accomplishing the goals you've been set out to accomplish. Like you're on my couch right now, buddy. And so like if it were working, don't you think it would have worked by now? And usually I'll get like a reluctant, like, yeah, okay. I use the sort of approach that I think a lot of us therapists use. And I'll ask something like, okay, so like, is this how you're, motivating your kids? Like, is this how you're teaching your kids to like talk to themselves and motivate themselves? Um, no, of course not, right? Like, well, why not? Like, you're adamant that this is what works for you. If it's that successful, why wouldn't you teach it to everyone you know? And being able to, again, shift the perspective a little bit for men to step back and ask, like, okay, wait, if I am holding on this tight to this strategy and I believe that I would be lost without it, why am I so adamant that I would never teach my own kids to talk to themselves this way? And I wouldn't talk to my kids this way to motivate them. But I think just being able to understand, right? Like I don't want to shame my clients, and I think incorporating humor and being able to like poke at some of these things is not poking at the client. It's like poking at the strategy, poking at the critic, poking at, something so we can separate it from ourselves and say like, what do we think about this? What do we want to do about it? But the reality is that so many men are suffering in silence, and so many men have they say the most awful things to themselves and think that's just the way it is. And so as a therapist, like I want to understand that. Like,
mm,
where'd that start? Whose voice is that? How's that working? How has it served you? Because it's probably not just been a broken coping mechanism. It's served you somehow. So I think being able to explore that in a really thorough way, but also being able to poke some holes in it as well by like using some logic. Like I think, using logic is everything in getting through. It's much more effective to go the logical route with my clients than to try to just focus in on like, well, but what does that do to your self-esteem? And what about, how you're feeling about that? Like, no, that's not going to go anywhere. But if I ask you like, okay, it's that effective? So you're using that strategy as a parent? No? Okay. Explain that to me. Help me understand. And I think, even for men being able to recognize like, oh wow, yeah, that doesn't make sense. Why am I
mm.
doing it this way? Elicits, that sort of curiosity, I think is huge. Like I'm often telling my clients, like, the goal here is to be more curious than critical. And I'll say, like, you're really good at critical and you're going to go there immediately. And my job is to be able to like highlight that. And we're going to pivot a little bit instead of asking yourself, like, why the fuck do I do that? Asking yourself, huh, why do I do that? Right? Like, just the tiniest little
Tone.
shift
Mm,
to be able to like understand that more versus just like pound into yourself like you've always done.
mm. I was going to come back to the man in the arena quote because in a funny sort of way, the first lines are, "It's not the critic who counts, not the man
Yeah.
who points out how the strong man stumbles and where the doer of deeds could have done them better. The credit belongs to the man who is actually in the arena." And I
Yeah.
wondered whether that applies internally and perhaps in this IFS kind of model
Mm-hmm.
that the critic is that part of the quote, that
Yes.
is making these comments and sort of criticizing and so on. But actually, it's about the man in the arena. Does that relate, do you think,
Oh,
intrapersonally?
absolutely. I love that quote for a lot of reasons. I love that it is the first thing my clients see when they walk into my office and they're sitting waiting for me, waiting for the session to start, just staring at that quote and reading it because I do think it highlights the strength it takes to walk into this office and how many people do not ask for help and walk into the office and the courage that takes. And also because absolutely it is about the parts that he is carrying with him and how self-critical he can be and how much shame he carries. But like look at what you're doing. Like you are in the arena, you're doing the hard stuff, you keep coming back, you're committed. And that takes so much more strength than sitting on the sidelines and and criticizing. So absolutely. It's the interpersonal
Mm,
and it's the intrapersonal without a doubt.
mm. Yes, it really is the wisdom, the strength, the courage. These are the qualities, I suppose, that we're bringing to the surface, but to sort of tackle this next challenge for people.
Hmm.
I often try and disentangle a kind of a self-hating self-criticism
Hmm.
from the sort of self-improving or, if you like,
Hmm.
constructive sort of self-criticism, because there are things that we want to be able to, reflect on and critique
Hmm.
and improve upon and so on. How do you do that? How do you sort of navigate your way through those different forms, I guess, of self-criticism with men?
Yeah, I mean, I love parts work for this IFS because it allows these, somewhat similar or overlapping parts to still be distinct. And so I think that's a cool way to be able to say like, okay, well, that's a different part. That part sounds a little bit more encouraging than this one over here. So that's one way. But I also like I really do love psychoeducation. I just think like informing and like arming my clients with information and knowledge is so powerful. And so I'll have clients talking about their experiences and I felt guilty about this or I felt awful about this. I'm a horrible person or I'm a monster. Like I shouldn't be forgiven, whatever it is. And I'll explain the difference between guilt and shame, or even the difference between guilt, shame, humiliation, and embarrassment, which is, often rooted in Brené Brown's work. But even being able to talk through like, let me just teach you the difference between guilt and shame because we're using these somewhat interchangeably, and one can be pretty productive and helpful, I think, and the other oftentimes is just toxic and stuck. And so I'll say, guilt is this misalignment between what you're doing or what you've done and your values. Like, what do you stand for in your life as a man, as a dad, as a partner? And guilt helps us see, like, oh, I made a mistake. Like, that wasn't me. What can I learn from that? How can I grow? What do I want to do differently? And that is helpful. That can be helpful. And that is I messed up. I'll fix it.
Mm,
And shame, on the other hand, is not I messed up, but I'm messed up. And
mm,
it is in some ways, right? Like shame from an evolutionary perspective keeps us in the tribe. It keeps us, on the right, within the bounds of, the social norms and expectations and rules. And that's great, right? Like we don't want to be outsiders or outliers in a community. We want to have safety and connection. that was especially helpful, thousands of years ago. Today, however, shame often is something that is really toxic, keeps us stuck, gives us these absolute beliefs about ourselves and makes it seem as if it is unchangeable, right? Like I said, it's not I fucked up, it is I am fucked up. And so if that is what you are telling yourself, if that's the critic, how do you get out of that, right? Like that is a very absolute, that's not, I made a mistake, let me learn from it. It is, I am unchangeable, I am unlovable, I am unworthy. So being able to help clients understand that and to see the function of these things and to be able to, if they are stuck in shame, to be able to say like, well, did you feel guilty about that? Like, was there something there that didn't feel right? And what did you learn? And how can you grow? Being able to use that as like a real cool opportunity and being able to challenge the function of that shame, like how is that serving you if you're actually in therapy now because you want to grow and change but you're trapped in shame, like how are we going to get out of that? I mean, I think the beautiful thing about therapy is being able to talk about the shame and have that vulnerability and feel empathy from someone is really the antidote to that experience. But I think, being able to again have that sort of information and approach it logically and say, all right, like yeah, that sounds like that wasn't you. It sounds like you don't want to do that again and you want to be a different man than that. Like how is that rooted in your values? Like let's review those. Like what are your core values now? Like what do you hold at a high standard? And then being able to help him live from there, like to get to that place again of like honesty and authenticity and feeling like the way he's showing up and living and interacting is in alignment with his like true authentic self.
Yes, no, I'm totally on board with that. I really love that distinction. And the thing that's popped to my mind is that self-compassion isn't kind of bubble baths and
Right.
it's sort of whatever. Self-compassion is the hard yards of moving from shame to guilt to repair and forgiveness.
Right.
Like that is what self-compassion really is, and
Yep.
it takes a lot of kind of strength and courage to do all of that, and to be able to sort of present the logic there and the information and highlight the
Hmm.
discrepancies and move
Hmm.
towards repair and making amends or growth or change, is sort of seems to be kind of the key.
Hmm.
Well, if boys and men, were more comfortable with compassion and
Hmm.
and sort of giving compassion. I mean, often men are very compassionate towards others, and
Hmm.
they often do it in very practical and sort
Yes.
of helpful, active kind of ways. And but
Yeah.
also, yeah, if they were to be more compassionate towards themselves and more open to receiving compassion as well. I mean, how could we get there, do you think? Like what might what would a world like that look like, and how could we get
Mm.
there?
I mean, I think if I had the answers to that, I would be doing things other than being on this podcast. Um,
Oh, I think you'd
uh,
still be here.
I think it'd be very busy. Um,
Yes.
I,
We
I,
ask the big
my,
questions here on Compassion in a T-shirt.
um, my thought went to, just like how we navigate the topic of masculinity right now. And um, I think that I mean, there's
Hmm.
just, it's such a polarized world at the moment. And things that get attention, even on social media where I exist, are things that are often explosive or rage bait and make people angry and get these strong reactions. And so we have, you see these conversations about toxic masculinity, or you see these, conversations about um how harmful masculinity can be, or you see men left out of important conversations, or not given sort of credit where credit is due. And to me, being able to expand on what the experience of masculinity is, and that masculinity exists outside of this rigid like man box, that it's not just about this emotional stoicism and being dominant and being the lone wolf, that it is, it can be masculine to be compassionate, and it can be a form of healthy, authentic masculinity to love deeply and passionately and publicly. It can be masculine to do things that, we may unfortunately categorize as feminine. I just feel like we've put such a limit on what what masculinity is allowed to be, or what gives men their man card, or what has it revoked. And I think women have, over the years, and thanks to many waves of feminism, been given opportunity to be celebrated for this, like, gender expansive more experience. And I'm celebrated as a business owner and an entrepreneur for like leaning into my masculine and being able to be more assertive. And I can own that and celebrate that, and even see that in my daughter and like celebrate that in her. And I don't think we give that same permission to young boys or men to be quote unquote allowed to exist more fully and honestly or authentically, to be celebrated for leaning into their like softness and their emotions and their compassion and femininity. And so to me, like that would be huge, like more permission to be dynamic humans, to not have to exist within these, rigid guidelines on what it is to be a man, or what revokes your man card. Because
Mm.
I work with, men in my office who are so sensitive, and they are so emotional, and they are so dynamic. And many men don't feel like there's much permission to exist that fully, even in their romantic relationships. And so I think, men having more room to be messy in that. Like, it's, if we're not teaching boys to be more emotional and expressive and name their emotions, then it's going to be really hard for men to learn that and lean into that. So allowing them to stumble and to struggle with that a little bit, but giving room for men to exist more fully and honestly, I think could go a long way.
Well, yeah, so a wonderful answer to a big and tricky question. Before I let you go though,
Hmm.
you're well worth following on I'm on Instagram. I don't think I'm not on TikTok, but I think you're there as well, and you post
Yeah.
some very thought-provoking, and I think you maybe even do that social media thing well, where you're able to be click-worthy enough, but still also be really true to the profession and true to the work and that sort of stuff. So,
Thank
but I
you.
think you might be also. Are you about to start a podcast or something like that? Is there what's ahead for you with this sort of thing?
Yeah, thank you for asking. I am plans are to launch the podcast in January, February of 2026. So in the next few months, podcast is already recorded, and we're just like in post-production editing now. But it's in collaboration with a colleague of mine, Dr. Brendan Kwiatkowski Hartman. He's a sociologist in Canada, and he works with boys and men, does a lot of work in schools around healthy masculinity and emotions, and focuses there a little bit more on the academic side, but does a lot of workshops and teaching. And of course, I come in as a psychologist on the clinical side of this work. And the podcast is called This Triggers Me. And so we're really taking a lot of the topics that you and I have hit on today and trying to come at them as full humans, not just as academics or professionals, bringing our human selves into it, trying to trigger each other a little bit, digging into conversations that are absolutely polarized online, with the hopes that we show people what it looks like to navigate uncomfortable conversations, to not avoid them. It's based on the premise that trigger warnings themselves Unfortunately, the research on trigger warnings shows that they often have the adverse effect that they serve to increase our emotionality. When you receive a trigger warning, you're priming yourself to react, and then often have an even stronger reaction to whatever content you might be warned about. And what would be most helpful is to arm people with coping strategies and encourage them to regulate. So the podcast is about leaning in to our triggers and not avoiding those difficult conversations. It's something that Brendan and I both do daily online. As far as I can tell, you can't exist as a female therapist for men on social media without strong feedback and some trolls along the way. And so I figure if I'm already triggering people by showing up and speaking to these topics we chatted about today, then might as well do that in a longer format.
That sounds very logical in a way. But yeah, no, I look forward to that actually. I was it Brendan? I think I did
Yes.
have I looked him up as well just
Yeah.
after
His
I saw
handle
that
is
you were.
remasculine.
Yeah, yeah. After I saw you were collaborating, I thought, oh well, that's interesting.
Mhm.
But well, yeah, Dr. Audra Horney, thank you. Well, thank you for your work advocating for my half of humanity, if you like, or something like that. I really do appreciate the work that you're doing and the messages that you're putting out there. But also, thank you for speaking with me on compassion in a t-shirt.
Yeah. Thank you so much for having me. This was fun.